Hello, everyone. I'm Shirley Ringo, and this is Every Woman CEO. And I want to invite you to our first show. It's a live broadcast, and so we're all a little bit nervous. And so we are going to talk to you today about trauma, the big T, and how important it is to have this conversation. And so today, as our guest, we have Dr. Robert Bray, who's a trauma specialist and has dedicated his life to the world of healing trauma, training clinicians all over the world. Thank you, Dr. Bray, for being here with us. And our other guest is Rafael Bolio, and Dr. Rafael is internal medicine international doctor with a focus on body image, body weight, and weight loss, and is a trauma survivor. And my co-host here is Sonia. And so we're going to give you kind of a full role view of what this is. I too am a trauma survivor, and with that, we're going to go ahead and say, why should we have this conversation?
We should have this conversation because I'm always excited to have this conversation with you, because I know that your mission and my mission is very much the same, which is to end suffering in the world, especially the unnecessary suffering that's there. Yeah. And in my particular way to approach it is by teaching people something called thought field therapy. So to understand how trauma affects people and what you can do about it. And that's the more important piece, is to know that we live in a world that's full of violence. We live in a world that's full of natural disasters and dangerous things. But that doesn't mean that it has to define our lives or change how we are with one another.
For sure. For sure.
So thank you.
Yeah, I think what I'm going to do is I'm going to show you all just a short clip, because there's so much new data and relevant information. And certainly in California, Kaiser Permanente did a great job on research with more than 17,000 of their clients to get an idea about the trauma and the lives and how it affects them in the medical field. So let's go ahead and roll that clip.
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or a pathogen chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence.
Pretty intense stuff, but it's really important for us to get a handle on this.
Well, I have a question, because, well, as the public here would ask themselves, okay, we're talking about childhood trauma, but what does this also imply that an adult would also have damage if they had a traumatic experience?
Well, there's clearly that when we have a traumatic event, it affects the way that our body responds. And when we're in a highly activated state in a life and death kind of way, and where our bodies are just trying to survive, that's going to affect the way that our physiology works across the board, and especially our healing, because being able to be in a relaxed, calm place to allow the healing to we'll often find ourselves reactivated or triggered by something that's around us that interferes with that. So yes, for sure.
Now, doctor, a lot of people confuse trauma with post-traumatic stress disorder. Can you please give us a definition of both?
Well, don't get too caught up in post-traumatic stress disorder. The PTSD is what you hear on the news, and you hear a lot of people talking about it. But the reality is that just means that you fit a diagnostic category that puts you in a certain way that people can talk about it. But the bigger issue is post-traumatic stress Okay, that affects us all, and how we recover from that is going to affect the quality of our life. So we can talk about those symptoms later if you want, so people can recognize it. But if you notice that when you think about something that's happened to you, you feel in your body something shift, not in a good way, then you're suffering with this post-traumatic stress, and your recovery is not complete.
Wow. I know that every time I even approach the subject of trauma and post-traumatic stress, I can feel it start to show up in my body. And especially since I had a lot of childhood trauma, just like she's speaking about in the video. But then there's the cumulative effect of having secondary things happen on top of that and then trying to manage them. That's part of the reason why I wanted everyone to have this conversation, because trauma in today's world, and probably in the past, it's at an epidemic state, and the medical society is not ready for that, or how to treat it, because you can't see it. You can't do an x-ray and say, yep, they had a lot of trauma. It doesn't show up quite that way.
I can say as a doctor, when I studied medicine, they never touched this subject. We talk about biology, we talk about chemistry, but we just barely touch emotions, and much less talking about trauma and how that affects human life.
Right?
It seems to be like a taboo subject in society. I come from a cultural background where you don't even discuss your mental health ever. Going to a therapist is frowned upon.
Sure, for sure.
So we have to ask people as they join us in this conversation, as they're listening to us, please remember that if you get triggered by something that somebody says to you, that something makes you remember something from the past, and you start to feel some upset in your body, try to hang with it as long as you can, because it's a normal kind of thing that once we're triggered to want to move away from it. But the problem with that is then we don't learn, then we don't work with it, then we don't heal. So just notice what you're experiencing as you listen to our conversation about these things. And don't be too afraid that if you pay attention, you're going to start feeling all this stuff and it's going to be too much. It's not too much. What I'll tell you is, most of you people who are listening to this who have trauma, you've been living with it for years.
Right.
Don't be afraid of it, because you've already figured out how you live a life with it.
For sure.
But
For sure.
now let's figure out how you live a life without it.
Oh, wow.
That is fantastic.
That's the piece. I think for me, finding a safe place.
Yeah.
And with my co-host, who I trust and appreciate, and Dr. Bolio and certainly Dr. Bray, that safe place, when you realize that can show up in your life, makes all the difference in the world, because
Absolutely.
it gives us permission to make mistakes and be human.
Oh, yeah.
Welcome to the human race.
Yeah.
This is
I like what the doctor says, that it's okay.
yes.
Oh,
It's
yeah.
okay. I
Yeah.
mean, that's something that is true. That's something that is, as you said, Shirley, is part of our society. And the first shift that I think we should be having in the way we think is that we have to accept that something that's true, and that we can view it, and we can work with it, and with your help, solve it.
For sure.
Now let's talk about the symptoms. What are the symptoms?
I can give you the more technical piece, but the piece that most people need to know is, the easy way to know is, can you tell the story of the event from the beginning to the end with appropriate affect? Appropriate affect means when somebody does something heroic, do you feel some pride?
Yeah.
Appropriate. When somebody sees someone harmed or hurt, do you feel some sadness or pain with that? You might even cry. That's appropriate affect. But if the tears become overwhelming and you can't talk anymore and you just melt down, that's over the top. That's too much. And that's an indication that you're not coping well, you're not healing well from it. Same thing as if you get mad because something happens. Yeah, of course you get mad, it's human, right? But being mad and maybe yelling is within the realm of normal.
Yeah.
Putting your fist through my wall and slamming the door as you go out, now that's over the top.
Right.
Yes.
So that tells you right there, you have unfinished business that you need to pay attention to. Now that's just kind of, if you want to try to get into the story. Post-traumatic stress, you have to know that there was an event. That's the first thing. And then you look at things like, do you have intrusive thoughts, intrusive images? So sometimes do pictures pop into your head when you don't want them there? Do feelings pop up when you don't want them? And that we call it intrusive. It's not like you're having a memory. So you look for that. You look for, are you going to have some avoidant behavior? Do you find yourself not being able to go someplace or not being able to do something because you just stopped? That could be a symptom. Do you have trouble getting to sleep? Do you have trouble sleeping? Do you have nightmares? All of those things happen in a normal way for people who have the most severe cases of post-traumatic stress. It's not unusual. I shouldn't say the most severe. It's not unusual to have sleep problems or nightmares. It's not unusual to find yourself sometimes feeling really depressed, you know. So sometimes we get really activated to avoid things. You know, I'm going to do something else, you know. And sometimes those things can be just getting to be a workaholic, but sometimes it could be an alcoholic.
Yeah,
Or it could be
either way.
running away. So those are the kinds of things we're looking at in terms of the functioning within your life.
Yeah.
Do you have one of the things is it's a startle response. So it's a normal thing for, you know, hear a loud noise, we jump a bit, right?
Yeah.
But if you got PTSD, you jump a lot and you stay on the ceiling. So that's a different kind of, and that hypervigilance that we have, always looking for where's the next bad thing going to come from. These are all the symptoms that if we were doing a clinical interview trying to decide that we would look at.
For sure, for sure.
Well, I can understand that if you were asking someone about this, but I'm sure that the public that is listening to us is resonating with these situations.
Yeah.
And I'm certain that more than one will be saying, hey, you know, I'm living through this situation.
Yes.
I have these symptoms, you know?
Yeah.
Yeah.
And at least in my experience, because I did go through a traumatic experience, I would justify it. I would say, well, it's part of life, and I think I can handle it. And when I didn't, I really wasn't handling it. And I do want to share that with the public, that there is a solution, and we're here to try to help you find that solution.
For sure, for sure.
That's very true. Some people may say, oh, this is just my personality.
Right.
I'm always on the edge. I'm a workaholic. You know,
Right.
I have high stressors in my life, whatever. And they may never recognize that it's an actual disorder and they need to seek help.
Right. And part of the problem is that you don't recognize it because you've been living it your whole life. Okay?
Yeah.
So you work with somebody who's maybe an alcoholic and you say, well, what are you running away from in your life? You have a great life, you have love, you have good things, but you're drinking yourself, you know, so you can't feel anything. What's going on with you? And they say, I don't know. And they don't know because they started drinking when they were 12 years old after that car accident or after that event happened. So it's like they're going, yeah, this is just who I am. Well, no, that's not who you are. You're trying to cope, but you don't have to hurt yourself in the process.
So let's just go for a moment, because we were talking about early childhood trauma and kind of the overflow. So we look at kids and we see children growing up in dysfunctional environments where they're physically abused, emotionally abused, sexually abused, or just neglected, or even abuse that may occur in the school environment about being bullied, or whatever that might be. And often other members of the families may be aware or not be aware, but children, my understanding is children all of a sudden can change their role and be a care provider for people who are being abusers, like a parent or an aunt or an uncle, and all of a sudden that part of being a child in innocence is taken away, and they end up being the one who is like, I got to make sure that my mom takes their medicine, and they're still a child. Right. So those pieces where these children are not diagnosed specifically with, they may be diagnosed ADD and all kinds of trouble issues later on, but they're not diagnosed as having post-traumatic stress, but they've had extreme trauma. Right. And the prevalence of that, Dr. Bessel van der Kolk, one of my favorite clinicians in the world, just amazing man, just talks about how we can do mean, miserable, horrible things to each other as human beings. And not because we don't love and care, but because often we're suffering with our own traumas and with our own demons. And that a lot of this is a big issue. But these children that are coming into the system who have enormous health issues, medical providers are not addressing the underlying trauma. So am I on the right track with the thinking on this?
Yeah, well, you're absolutely on the right track. And one of the things that you have to always remember is there is no maladaptive behavior among children. If you see a child and they say, well, they're maladaptive, no, that child is doing the absolute best way they can to deal with whatever's going on around them.
Yeah.
And that is the thing you have to keep in mind. These kids are taking care of these people who are abusers because that's how they stay alive.
Yeah.
That's how they know that they're going to survive, is by doing these things.
Yeah.
So what happens is, yes, you do what you have to do to tolerate it, to manage it, to stay alive. And as you do that, you learn, you get really good at not paying attention to your own needs.
Wow. I think as a child, I always believed that no one would come for me.
Yes.
I had a great mistrust for school because I grew up in a very regimented school where you were hit often and painfully, like with yardsticks and straps for not being able to do the simplest of things. And being dyslexic, I was always getting my letters backwards. Till today, I still do. But to be beat for it changes the way I seen the world. And so then I didn't trust the church to help because no one seemed to know what to do, and my parents didn't have the skills to be able to intervene and help. Getting angry is not the way to solve a problem for a young child who is having visual problems in school. So that was my foundation going forward. And so today, when I go in to get, I'm a cancer survivor as of April last year, so feeling very fortunate and lucky to be alive. And yet, nobody touched on whether there was any early childhood trauma or whether or not my stress level was appropriate. So how do I know? What's my inner gauge? I know Dr. Vanderkolk would talk about the messages in the body, how important it is for us to pay attention to ourselves, to our breath, to our heart, what's happening and what are we feeling. Being connected to my body only happened in the last few years. I don't think I was connected for decades to my own body, but from early childhood trauma. But there was no place to go. I didn't think anyone would come for me.
Right. The solution is go to a doctor like this, because he knows the experience,
Yes.
and he will ask the questions
Yes.
that say this is important to talk about.
Without shaming me, I assume.
Definitely.
Certainly, that's a
No,
big piece. I mean, that's part of the reasons, I'm sure. It's like, who wants to have any more trauma? Who wants to feel embarrassed or broken or
Judged.
afraid or judged? Absolutely. So when you go in to have this conversation, it takes a lot of courage. I think
yeah.
it's bravery.
Yeah.
Sitting here to do this show and being honest and integrist
Yeah.
takes strength. And you know what? That's the piece that I still have, that no one took away.
I can mention from my experience, my expertise at this moment is weight loss, and I try to help people change the way they eat. I try to help people make better decisions around food. And when I ask them about their emotions, they usually deny them. They go, "Oh, we're fine. We're fine." Yeah.
Yeah, we're fine.
We're
yeah.
fine.
Yeah.
Exactly.
Yeah.
And it isn't until they start finding difficulty
Yeah.
in following the program and getting anxious and getting upset and getting angry, when they finally start recognizing that, yes, I do have a problem.
Wow. Wow. That's really,
So one of the things that people can do, just that's not stressful at all,
Yeah.
is when you're going to a physician, a counselor, somebody, just ask them the question, what is your expertise in the area of traumatic stress? Have you had some training in it? Have you had some experience working with it? And and you can just ask that question the same way you'd ask a question of any new professional you might engage with, without having to say, and I'm coming because, right? Now, if they know anything about post-traumatic stress, they will very quickly reassure you, and then you'll be able to get into it. If they don't know anything about it, they would say, well, why does that matter, right?
Yeah.
And if they're saying, why does it matter, you probably should guess that they don't want to deal with it.
Yeah.
You know, and that's the message. And, you know, you can test it. You can say, well, it matters because I think that I have some problems and I need some help with it. Are you the guy? Are you the woman who's going to be able to do that?
Again, you have to be in that vulnerable state.
Oh,
in order to
yeah.
do
No,
that.
it's not easy.
And it's very difficult to
Yeah.
even trust a family member, let alone your doctor.
For sure.
Judgment is huge. You know, people don't want to be judged, and then there's shame, and you know, nobody wants to be put in that awkward situation. So how do you? I mean, besides asking them if they have a background in trauma, what are other methods that you can recommend that patients?
Well, I think you give them a little bit. It's like how we learn to trust anybody, right? We give them a little bit, we
Yes.
see what they do with it, and we
Yes.
see if we can trust them with that little bit. So if somebody's got a problem, you know, when they start to talk to me about it, they're watching how I respond to
Absolutely.
it. So you give
Absolutely.
them a little bit, if you can manage to,
Yeah.
and you see how they respond to it.
Asking for a friend or something.
Yeah, there you go. And you see how they respond to it. And then, you know, my approach is you trust people to the extent that they have shown themselves to be trustworthy. And I think that's absolutely, when you're looking for professionals, that you have to not trust them just because they have a credential.
Right.
Yeah.
You need to give them a little bit, see what they're trustworthy, and then you can give them a little more.
I always say, you know what? We're really good at this. This is reconning. When
Yeah, yeah.
when you have trauma, or you have friends who have trauma, you bet they know where the exit is. They know who's doing what in the room. They're reconning all the time. So when I meet a new professional, and they say, "Well, what do you mean?" I'm like, "Okay, full stop." Because if I get there and they have no idea, I'm not there to teach them specifically. I'm there because I need them as a care provider.
Yeah.
So I now really kind of have a preface, like when I go, I'm like, you're my doc.
Right.
When I got someone who said like, hey Shirley, you're intelligent and articulate, I love having a conversation with you, versus you need to be medicated.
Yes.
Right? Like, okay, what
Nobody
camp?
wants to hear that.
What camp you going to be in?
Yeah.
And that brings us to medication. So
Is it an option? Is medication an option?
I think that there's,
We as doctors, what we try to do is
Yeah.
find this pharmaceutical that
Right,
will change
right,
the way we think or we
right,
feel.
right.
And I would ask you, what is your experience? in that?
My experience is that medication is good for symptomatic relief. I mean, almost in all of the work that I see, what you may get is some symptomatic relief from it, but you don't get the healing.
Yeah.
You don't get the results.
Really.
You know, if somebody is, you know, if they think that they can't sleep,
Yeah.
well, you know, you don't sleep for 3 or 4 days, it'll make you pretty crazy. So, you know, but we let people, you know, really what we want is when somebody has a major traumatic event, we don't want to medicate them right away, because we want to give them a chance for their own natural processes to go along. So you try to let them sleep on their own. You know, if a week goes by and they are not getting any decent sleep at all,
Yeah.
you might go to the physician and you would say, what can we do to help them get a good night's sleep?
right.
Then it's good. Now, there are other medications that might be helpful if there's an underlying depression or underlying anxiety that's going along with this. But again, it's symptomatic.
For sure.
Yeah.
But that's where the epidemic is coming in. You know, we're creating a society where we have an increased dependence on antidepressants, on opioids, on painkillers, on prescriptions. Yes.
I feel like it's just making people worse, right?
Well, I think we have to be very careful about saying we're going to take a pill to fix
Yeah.
who I am, what my experience has brought me to. And I think that the less we do of that, the better. But
Yeah.
it takes courage, it takes strength, it takes support, it takes knowledge. And you have to be willing to say to somebody, it's okay if you want to cry, then you know what, maybe you need to cry for a while. And
Yeah,
it's
for
okay
sure.
for you to avoid that for a while. If you're not ready for it, it's okay to avoid it. And to be an understanding kind of a person who says, I get it. There are things in our life that we don't feel in control of.
Yeah,
Guess why?
Yeah, I think the knowledge for me, knowing what the undertones are, and understanding that some of the medical things, the stressors, the not sleeping, not knowing the cause myself, that's scary.
Yeah.
So helping people, because not until we know,
Right.
as the public, that I might not be sleeping because I might not be able to handle the stress of my children because until I get a handle on that myself, that
Right.
it's okay, then I can go to my doctor and have a conversation, because otherwise, all I know is the symptom,
Right.
not the cause. So I can't take the splinter out.
Right, right.
I can't heal it, I can't address it, and I don't give value to myself as a human being. And that's what breaks my heart when I look out and I see people with trauma. And I spend a lot of time with my military friends and their traumas, working with them, and seeing the simplest of questions like, do you think God will ever forgive me for feeling and thinking the way I am, for not being a good parent? I don't want him carrying that cross. I want to be able to sit with him, and as you would say, Dr. Bray, that individual, that story, that person, give him the space he needs, that he can feel like a human being again and move forward. Because then maybe I don't need 12 pills.
Right.
Maybe I need just something to help me with my sleep until I can regulate myself.
Right, right.
Instead of taking all of these pills and still at the end of the day feeling like a failure. That's where I see it right now, and I'm hoping that by doing this kind of work together,
Right.
because I think this is a good team,
Dr.
you can change it.
I heard a word that just hit me immediately. Shirley was saying regulate myself.
Yes.
Is that possible?
Yeah.
Oh, okay, that's fabulous.
Yay!
Well, you
One
know,
for the team.
there are lots of techniques, and I hope as we go along, I'll be able to show you more and do more. But
Yeah.
we self-regulate all the time. And so the key is to be able to do the self-regulation first requires that we pay attention. The biggest problem with self-regulation is people aren't realizing that they're exhausted, that they're depleted, that they're so anxious they can't think. So the first part of that is you have to be able to be aware of what's going on,
Yeah.
because you don't know which way to turn that
That's the
valve, right, to regulate it, unless you know what's going on.
There's
Right?
something going on.
Right, right.
Yeah.
And then once you know there's something going on, there's lots of ways that we self-regulate ourselves all the time, having nothing to do with anything fancier other than just saying, oh, I think I'm tired. Well, go sleep, you know, or you know what? There's too much noise in this room. I'm really anxious, and you notice that. You take yourself to a quieter place.
Yeah.
Right.
These are all in the service of that self-regulation that you're talking about.
And they're good.
Oh yeah, yeah.
Self-care, yeah.
Yeah.
I think that's something that we kind of tend to overlook.
Right.
Oh, big time, big
We're
time.
too busy taking care of others, as
Yeah.
a mom, you're too busy focused on your children. You're like,
Yeah.
oh, okay, I'll be fine.
Yeah.
And before you know it, you're overwhelmed by the end of the week. Yeah.
It is. We have a tendency to push those things because of high stress situations. So if I was in an environment where my mom and dad were fighting and breaking things, anything less than that was going to be okay. So, right,
yeah.
it's like, okay, everybody's safe, we got this.
Yeah.
So again, that reconning kind of mentality as you go forward. So then, when the simplest of things like, did I eat? Did I sleep? Did I shower? Don't seem to be so important anymore because it's just staying alive that's important.
I literally forget to eat sometimes. I'm that busy.
Yeah.
I'll
Right.
I'll drive my car. I'll be driving my car, and I'm like, oh my god, it's 6 p.m. I haven't had dinner yet.
See how easy it is to go down that road?
Yeah, yeah.
Right?
You know.
Whether you have trauma or you haven't had trauma, it's still so easy in this giddy up world to forget to take care of ourselves, whether it's healthy eating, Dr. Bolio,
yes.
and how that affects people.
I once
So-
told her for doing that.
So really your clients that you see on a regular basis, I mean, primarily you see more women than men.
Unfortunately, I do see more women than men, and because men have the same problem as women, but in this society, and I don't know if in other societies, and this goes across the board, not only for weight loss, but any other problem, either whether you're coughing, you have fever, or you have something, it's the women that go and try to solve the problem, and the men go when they should. It's too late.
Yeah, yeah.
They're way over the edge by the time they get there.
Well, and I'm wondering if you see, one of the problems is that somebody is saying that they're depressed, right?
Yeah.
But there's a difficult line to be drawn because people are depressed because they have no energy, right? So if somebody comes to you and says, I'm depressed, I mean, it must be, the first thing you got to think of is it because you got no fuel to run your system, right?
That's the very first thing I think of.
Yeah,
It's the very first
absolutely.
thing. Before getting to that diagnosis of depression, first
Yeah.
I try to make them eat better in a
Yeah,
more
yeah.
balanced way. And usually their fatigue goes away in
Right.
3 or 4 days.
Right. And then they
Yes.
look a lot less depressed.
But there could still be an underlying problem.
Right, right. But and there may be some post-traumatic stress with it.
Yeah.
But the problem is that we are one mind, one body, one spirit, right?
Yeah.
We exist as a complete thing. And
Yeah.
anytime you start talking about things of the mind, you're talking about things that happen in the brain, which is talking about the body. And that interaction between the physical and the emotional, the psychological, and the spiritual, those things have to be looked at in a totality, because if you don't, you're not going to get to the key problem.
Yeah. I don't know if there's a lack of skill set, and maybe there is, or a lack of knowledge or understanding, or are we comfortable as a society addressing the issues of trauma? And I'm kind of in between on that, because I think most people would not really want to hear a bad story, or a story about abuse, or a story about someone in their family being traumatized. And so even though it's so important and so critical for us to understand this, we want to push it away as a society. I don't necessarily want to expose my traumas to other people, but I know that the work that I'm doing makes a difference for other people, because I have the tools to be able to self-regulate. Most of the time, it still shows up. There's days I'm like, I'm too tired and I really can't step into it, but it makes a big difference. So,
Well, actually, people don't like stories with a bad ending.
yeah, yeah, that's it. That is exactly.
We
Yeah.
want to hear stories with good endings. You
Yeah.
know,
Yeah.
the good guys win.
Yeah.
And,
Yeah.
Right.
and sometimes in this situation and stress, if you don't address it correctly, there are no winners.
Yeah,
No
yeah.
winners.
And that's
Yeah.
the key. There can be a good outcome, because what I tell people is, when we were talking before about tell your
Yeah.
story from beginning to end. Well, when you get to the end of your story, it doesn't necessarily have to be a happy ending, but it has to have some sort of meaning to you. It has to give you a purpose. It has to inform your life. If you can use what's happened to you to inform your life and how you interact with other people, to me, that gives it some value. So you're right. I mean, we may not be able to get to a happy ending on a lot of these
Right,
stories,
exactly.
but we might get to something that has some value or purpose.
There's a resolution in coming to terms with your old normal
Yeah.
and creating a new normal, and that is when I got comfortable enough to have the conversation about being a child that grew up in a very dysfunctional environment. But it wasn't just my home that was dysfunctional. It was pieces of my church and of my school. And I thought, as a little kid, is this ever going to get better? And so it was scary, but I needed to get past it in a place of, this was my experience, and being able to tell my truth, whatever that is for whoever it is when they have a trauma, to be able to tell their truth is critical mass. So is there any kind of story you want to share with us?
Yes.
Just checking. This is kind of, it's important, because I want it only tell this story if it's comfortable enough for you to do that. And so,
Before telling the story, I would like to do a little bit of back history.
yeah,
I did live a very, very intense, difficult emotional situation. I come from a country that is there's a lot of organized crime, and so I was kidnapped in a violent manner. With a gun put to my head and blindfolded and thrown on the floor. But what I would like to talk about before I go into this is that when I came out of it, and as a professional, I'm an expert, I'm an expert in internal medicine, I looked for experts to try to help me, and they were all afraid. They had no idea what was going on.
Because if it could happen to you, it could happen to anybody, and them, yeah.
yeah,
And so I went from one therapist to another therapist, and they would tell me, well, this is a situation that is happening, but we really don't know how to treat it.
Wow.
We really don't know.
that's scary.
That is
That's scary.
And so I went through rational emotive therapy. I went through, I was able to go to different specialists, but they did not have that experience.
Yeah.
And you really need someone who knows what they're doing to get help.
Yeah.
To really
Yeah.
go.
Yeah, let's not go down the road he went down, you know.
Talk
Yeah,
about
yeah.
tap dancing,
about tap
right?
dancing.
On tax, no
Yeah.
doubt, trying to figure your way through.
Yeah.
Yeah,
Yeah.
but what I can say as a general, like covering my
Yeah.
whole psyche, my whole personality, it was fear. It was fear. I came to the realization that we are not really in control of our life. You know, there's so many things can happen around us that we are not able to control or work on an outcome.
Yeah.
And until that moment, I felt very confident and very certain of what I was doing
Right.
as a human being, as
Yes.
a professional. And then suddenly I get slapped in the face by reality.
Yeah.
And it's hard. It's not easy. It's not
Yeah.
easy. And then you're starting to try to control your surroundings, and then you over
Compensate,
Right.
yeah, yeah.
Big
and
piece.
I do recognize that for years all my decisions were based on fear. And obviously, when you make choices on fear, you don't get it.
It's not good
It's
outcome.
not a good outcome.
Yeah.
Exactly.
But look how long it took.
Yeah.
It was
Right?
a long process. It was
Yeah.
a long process. And I'm very happy to mention to all the people who are looking into this program that there is a solution, and it's accessible. It's not rocket science.
Yeah.
It's not rocket science.
Yeah.
You don't need a PhD
Yes.
to address this situation.
Yeah.
And obviously, now that I understand what's going on,
Yeah.
why I wasn't able to reach that area to fix it, and how there are things that you can do to fix it, it's very, I mean, it changes your life. It definitely changes your life.
So one of the things that I know is, Dr. Raphael, is because we've been working together, is that when you go dancing, you're a different man. And I want to know what that's all about.
Oh, it's wonderful. It's almost miraculous. I had 2 left feet. But that was not an impediment for me.
But see, it was never, you started dancing, but you didn't realize the benefits.
I just
Of
felt
dancing.
so happy. I felt so in contact with myself.
Yeah.
I felt so secure.
Was that an
Yes.
outlet for you?
Totally.
Yeah.
It was a total outlet. It was like, oh my, this is so wonderful.
Everybody has to find that. You've got to know. You've got to find those things in your life that, when you enjoy them, you come totally into the present moment. I bet when you're dancing, you don't think about the past. You don't think about the future. You're just right there in the
Yes.
music.
Kind of
and-
move those,
Watching.
move those feet.
Yes, why do you about the past or the future?
Right,
I'm
right.
enjoying it so much.
Exactly.
Absolutely.
Exactly. And that's one of the healing things. That's one of the things that you can do, is find those things that bring you totally into this moment where you feel safe, where you feel like you're enjoying who you are, where you're finding some joy in your life. That gives you a different experience. That experience, that different experience, is healing. And it helps you know that you are safe now and that you can move forward in that way. But it's, you got to find your joy, folks.
Yeah,
I mean, that's
absolutely.
And I'm not a good dancer, but I enjoy it so much that it's and this is something I'd like to share with the public. You don't have to be an expert in something to find a way out.
For sure.
Yeah. No, and what you're talking about in terms of, we just pay attention. You can notice what kind of dysregulation is going on. You can take steps to regulate your system.
Here's the situation, Bob. I knew what was going on. I knew as a doctor.
Yes.
I knew all
Right.
the sick symptoms. and
Right,
signs,
right.
And but that was useless for me.
Right, because there were some missing pieces.
Exactly.
There were some
Exactly.
missing ingredients. Part of that is for you to have somebody that you can talk to about it, that gets where it's coming from. Part of what's, the difficult thing is human beings have this we actually have a part of our brain that has to make sense. That's job is just to be rational and to make sense of things. And when we find ourselves in this dysregulated state because of the events that have happened in our attempts to save ourselves and to stay alive, we've got to come up with a way to make sense out of it.
Yeah.
And part of it is that just having somebody say to you, the story is related to the event, can help, because it gives you a way to make sense of it and to say, oh, I'm not crazy.
Yeah, how nice is that?
I'm not crazy.
I have my crazy friends and I love them.
Right.
It's like-
Yeah.
No, I think having a support group
Oh, absolutely.
foundation is extremely important to get through a disorder like
Oh, yeah.
this.
Yeah, but here's the thing. There's a science to dancing. Strangely enough, because trauma, when this happens to you, it's not specifically about language, so trying to talk your way out of it doesn't work.
No.
But every cell in your body is impacted by trauma. That's why the health issues, every cell. And so when you dance and you move your body, you're releasing some of that trauma and that anxiety at a cellular level, and it helps, and you're in your body. Dr. Bessel van der Kolk, with all of his world of knowledge from Harvard to being the head of Harvard to dealing with veterans, he punched the wall. He does have post-traumatic stress. Love the man. Punched the wall and says, I am not prescribing
Right.
more drugs to my veterans coming back. He said, it's not healing them. I want them to dance. I want them to do yoga. I want them to paint, horseback ride, climb mountains.
Meditation, and there's
Meditation,
and there's
yes.
excellent research
Yes.
research that's been done on this.
Yes.
So if somebody looks at you and says, "What,
Yeah.
you're going to meditation? That's going to help you?" You say, "Yes."
Yes,
and
I am.
Absolutely.
And you can say, you can point at the, and it's the work I do. We can point at the research that says, there it is, right?
Yeah.
And if anybody says to you, there's no way to get better, you need to tell them, go back and look at the research. Go back and study a little more, because there are lots of things that can be helpful. And that's the beauty of what he figured out was,
Yes.
I'm not doing these meds anymore. We've got to find a better way.
For sure.
Something that Shirley said, and I don't know if the public captured this idea, and I would like you as experts to expound on this, because we're right now we're in a logical area. We're talking about
Yes.
what trauma is and about what post-traumatic stress is. And then Shirley said something that was, if I didn't know, it would be frightening to me, because Shirley said, well, you can't talk to it. You can't And so I'm sure the public, whoever heard this word must be asking themselves, okay, if I can't talk to my problem, if I can't solve it through a rational, like a logical sequence, how do I solve it?
Well, the way that you have to recognize this, and he does a good job of talking about the difference between the front of the brain and the back of the
Yeah.
brain. I talk about the top of the brain and the bottom of the brain. But it's really recognizing that there's a part of our brain, the top of our brain, the frontal cortex, that we use for abstraction, for being able to come up with symbolic language, to come up with language, to be able to do mathematics, to be able to do these calculations. All of that happens in the top of our
Which
brain.
is how I was trying to solve it.
Right, but the problem is not in the top of your brain. If I said to you what happened, you'd say, this. There was no question about what it was. But the problem is that the part of the brain that holds that trauma, that holds that perspective that says, I should be afraid, that fear that you're talking about, that part of the brain does not have words.
Does not have language.
It's the midbrain, it's the limbic brain, but you can communicate with it, and you communicate through experience.
There we go.
Experiential is the language of that part of the brain.
It
So you
deals
have
with
to
it.
give it a whole different, you have to communicate through an experience. So when I'm sitting here talking to you right now, we're having an experience. Now you're hearing my words and that's all going on up here, but there's another part of you that's listening to the cadence of my voice, that's listening to the tone of my voice, that's watching my movement and seeing how I am. That, we're talking to Bob, the bottom of your brain there, through that communication. So the words that are happening is communicating with the top of the brain, but the experience of being here is communicating to the bottom of the brain, and in that communication is how you heal. Is the message to heal. Yes, and that's why yoga works. That's why those other things.
You feel it
It's
in your body
experience.
when you're anxious.
Yeah.
What happens in the body? The contraction. What do you feel? You feel it in your body. So you can't say, "Okay, body, stop
Tense
that."
up, right?
Yeah. Saying
No matter
stop
what
it
you
doesn't
say,
stop.
It's not going to happen.
Yeah.
But go dancing,
Yeah,
Go dancing.
Yeah.
change the
And
experience.
it just releases.
Exactly, it's
Yeah.
perfect. So that's the big piece is, we do it in isolation, it doesn't work. If we just give someone a drug for a symptom, it's not going to bring
Well,
them where they need to
I
go.
used alcohol. I mean, I'll be honest. I
Yeah.
mean, I had to go through alcoholism, and it did not blunt the pain.
Well, what it does is it numbs it.
It numbed it.
Right, but it kept coming back is the problem.
Coming back,
Yeah,
exactly.
yeah.
Mhm. Yeah.
So what did Bessel say? We watched some things with Bessel. He said about addictions, for the most part, your addictions with alcohol and drugs is, he said, rarely will you ever see it with an underlying traumatic event in that person's life.
Before they started that, because that
Yes.
becomes a way to avoid feeling. But drugs and alcohol don't allow you to not feel that fear, that allow you to not feel that scariness
You
that's
numb
life.
yourself.
Right, and so you kind of go on in this unfeeling place. The problem with it, though, is
You're not happy.
and you really can't get happy because that happens in the bottom of the brain, that happens in the body.
Exactly.
And the alcohol just numbs all of that for
Well,
you.
I think this is a bottom-up, top-down kind of thought for me. It's like, I believe that if we help doctors understand what it's all about, outside of their clinical information,
Yeah.
right, on a personal, emotional
Right.
space, and we help people who are here, who are struggling with it, realizing that they're not broken, they're not somehow not a whole person anymore. Help them understand, then they can ask the right questions, and we can meet somewhere in the middle. That's my goal, is to help them. Can we please create partnerships, community, medical, educational partnerships who really understand that the people in your room, when you're looking out at a classroom, there's going to be a great deal of trauma in that room. And you need to be open to that. The person who's afraid to sit up front and you force them to. The person who's always sitting by the door and then you say they can't. There's reasons that we behave the way that we do. And it is about survival and comfort and understanding. And we do it automatically, and especially if we have a lot of trauma. We're going to have some issues. But let me tell you, the smarter you are, the harder it is. It's because then you
Because you keep trying to figure it out, you know?
It's like,
Everything.
you think that the body keeps the score?
You said something wonderful, and I hope that all our people who are watching us take it with them. Having trauma does not mean that you're broken.
No, absolutely not. And I look at people like Bester van der Kolk and Dr. Bray and many others. A lot of them had a lot of trauma and went seeking answers. And because they're really intelligent individuals, went into the field, being care providers and teachers and trainers. This can be different. It doesn't have to be this way. It doesn't have to be so dang hard to heal from emotional trauma. So do you think we're going to make some headway doing this series?
Absolutely.
Oh, yeah.
Yes.
With Dr. Ray's help.
I think they're going to have some amazing people because you know what? As valuable as Dr. Bray is,
Yeah.
you are equally valuable,
Yes.
and so are you. It's about communication. It's about a team coming together with ideas and thoughts and questions. We got to do it that way. There's
And
no
creating-
one's going to do it on their own.
Creating the experience.
Yes.
Because that's what's going to change
Yeah.
how we are in the world and how we are with each other is through these experiences that we have where we can say, it's okay to be who you are.
Yeah.
It's okay to share your thoughts and your feelings.
Right.
It's okay to be able to process what's happened to you.
So,
Breaking that stigma.
oh,
Letting
absolutely.
people know it's okay. There's nothing wrong with you. You're not broken.
Absolutely.
Can be happier,
Oh, yeah.
can be more relaxed and more enjoyable.
So we can be the fire starters and the trailblazers.
Yeah,
We can help the institutions, we can help them, we can help the universities and practitioners and communities connect the dots. Come on, the research is done.
Yeah.
Kaiser
really.
Permanente did a great job. They're not the only one putting research forward. This has been around since the 1600s. They've been gathering information.
Yeah.
But everybody keeps burying it into libraries because we don't want to address it because, again, we can't take the x-ray of it and say, okay, now we can fix it. Because we're a fix-it society, aren't we? Let's fix it.
If we don't see it, it's not there.
Exactly, for sure. So pay attention. It's there, it's big, it's real, it's alive. Some of the most amazing people in this world have gone on and done extraordinary things.
Yes.
because they've had experiences that challenge them beyond measure.
Right. And we have to remember always that the thing that is real and makes our lives work more than anything else, you can't see it, but love is all around us.
Yeah.
And love is
Yeah.
what carries us and holds us together.
Love it.
Nobody can see it. You can't take a
That
picture
was
of it.
sweet.
I love it. It's good.
I love
Good.
love.
You know, we're looking out in a society right now where we're seeing reactions to trauma that kind of startle me. We're getting a little bit I don't know if numb is a good word, because we have, I mean, mass shootings. You've been consulting in the front lines for many of this. And then I remember a couple of years ago when we had this disaster in Florida in the nightclub.
Yeah.
And I went knocking on Dr. Bray's door. And I said, Bob, you didn't post anything. How come you didn't post anything? Like, really?
Yeah.
This is your wheelhouse, man. You're
Yeah.
a trauma expert. Where is it?
Yeah.
So Dr. Bray looks at me and I said, flip up that camera and let's go, man. We got to do this.
Yeah.
And he gets teary and he says, I think I'm numb.
Yeah.
I didn't know what to think. I'm really
Yeah.
sad. I'm coming to terms with
Yeah.
this.
I just, you know, when the school shooting in Parkland happened, what I realized was when it first hit me, I started to numb, because I'd done some work with school shootings in San Diego years before, and that is very powerful stuff when you're sitting with kids and teachers who've seen these things. And what I realized was, oh, I'm getting triggered. So then I take care of myself, and then I invite other people to take care of themselves. And so I got it up on the website the day after this time. You know?
It's like, man, you didn't want me knocking on his door.
And I got to tell you, the one thing that's just amazing to me is the hope that I feel when I look at those kids marching.
Yes.
We still see, I mean,
So inspiring.
Oh, isn't it though? And it's like they see possibilities that I can't even fathom at this point at all.
Yeah.
And that brings me hope to know that there's all these new possibilities that are coming alive right now
Yeah.
that are going to change the way we treat one another. And that, if you really want to deal with trauma, you got to deal with that other piece of it. I was teaching class once and they asked me, so what's the best way to prevent traumatic stress? I live in San Diego, and we know that if we had a 6.0 earthquake there, it'd probably cost a couple of thousand lives. 15 miles south in Tijuana, we know that it would cost probably 60,000 lives. And so we're trying to think about how do we prepare for this, how are we going to help one another, how are we going to do this stuff. And somebody's saying, so how do we prevent that?
Yeah.
And I said, building codes. Because if you look what's happening in Chile and Argentina today, they get it. The best way to prevent traumatic stress is to prevent the trauma.
right, right.
Yeah.
See, and again, trauma's not always something one person does to another.
Right.
Yeah.
Or an act of war. It can be an
Just
earthquake.
life.
Yes.
Yeah.
So it is welcome to the human race, because
Yeah.
trauma is existing around us all the time, but the way we deal with it
Yeah.
has not really moved us. So what do you know now, both of you, what do you know now that you didn't know 5 years ago that really changes the way you see trauma and the environment that you live in?
Excuse me.
Well, in my case, I can say that thanks to the therapist that treated me and showed me his technique, it's a way out of it, and it's not that difficult. You do need to do it, though. I mean,
You got to show up.
That's right.
It takes work, you
show
know?
up,
Yeah.
you have to do it. But once you start doing it, then you start noticing that there are changes, and it's not difficult.
Right,
It's not.
Right.
I'd say it's not impossible.
yeah.
But
Yeah.
you have to take the steps. And so I'm very happy to share with you that although it is a complicated matter, I mean, we are living an experience that where humanity has been through us through ages.
Yeah, yeah.
There are solutions and accessible solutions.
Yeah. I think in the visceral experience that we have to feel in our body, that we feel right now, for me, it's just like that there's hope and there's possibilities,
Yeah.
right?
Yeah.
So, Bob, your thoughts for that same question?
This is your life, Bob.
Well, yeah. I mean, when you say 5 years
like
ago.
in this last 5 years.
In this
I mean,
last
you've been
5
around this field a long time. Come on, in
Well,
decades.
okay,
So
so-
these last 5 years, though, there's been a lot more.
Right. Well, the thing is that in the last 5 years, I've just quit arguing with people about things that are known. You know, if I know how, yeah, it's like you're going to help people, you're going to do it. And if somebody says to you, oh, you can't do that or that won't work, you know, I've just gotten the last 5 years to a point of saying, don't tell me what works and what doesn't work when I've had the experience of it and when I've done the research and when I know this stuff. If you don't want to do it, that's okay, but don't tell me that I don't know or that it can't help it.
Yeah.
If you're not ready now, okay, I understand all of that. But what's changed for me in the last 5 years is just not having much tolerance for people who get in the way of being able to help.
And I think that's what you have in common with Bessel. He's
Yeah.
way past it. He's over it.
Yeah.
Got my T-shirt. I'm done.
Yeah.
Here's the deal.
Yeah.
I got decades in this field,
Yeah.
and I've tried everything. I've been there. And let me tell you, until you walk in my shoes
Yeah.
and you've had these experiences, please don't tell me
Yeah.
that dancing and yoga and TFT
Yeah.
and other things don't work, because I've seen the miracles. I've been there. And I know that they really make a big difference. So one of the things that we didn't touch on, and I want to really bring this to you,
Okay.
is there's a cultural mosaic. There's a piece. This is a country of immigrants. A country of immigrants. And one of the things that we often overlook is what the dynamics are for people who move here from other countries and what their experiences are, both in terms of culture shock or in prejudice or adjustment or just different mosaics for them and what that might look like. And because your family,
Yes, I'm first generation American. My family moved out here in 1984. And it was difficult, you know, being an immigrant, not quite knowing the language, having to adapt to the culture change, foods, people, work hours, everything. It was just different. So my dad, you know, we've had this discussion in the past, and he tells me how difficult it was because his education didn't count. He had to go back to school.
oh, bless his heart.
Yeah.
Bless
And
his
he,
heart.
you know, and like he's like he had to drive the cab, he had to deliver the pizzas, he had to, you know, share a room, you know, have weird roommates, you know, the first couple of years, and it was extremely difficult for him. And then, you know, he knew the language. He went to an English school in Pakistan. However, it was still difficult because the accent, you know, that would kind of throw
That
him
would
off.
separate him from the rest.
Yeah.
Yes, and you know, I get really emotional just talking about it, thinking
Sure.
about it, because it's like he did it for us, you know, and he did it to give his children, his family, you know, an opportunity that he did not have growing up.
Earlier in a pre-discussion, Dr. Bray said, we asked the question, do you think that your family experienced any traumatic events? And you said, oh, no, perfectly boring family. And Dr. Bray said, oh, so the story goes.
So they don't tell us. Yeah.
Because we don't share with our children.
Which is right,
You know,
because now
it would
she's
scare
an
them to
adult, right? But as a child, of
Yeah.
course, you don't share with
No.
your children that scary
Nope.
stuff.
Yeah.
You always want them to feel safe. But the problem is, she can take it. you
I
know?
can take it now. I'm gonna go home and pick his brain a little
Yeah.
bit because
love it.
you're right. He didn't give me the day-to-day breakdown
Yeah.
of his struggle.
Yeah.
Yeah.
You know what I mean? And that's something that I'm really interested in knowing.
And one of the problems is when you come from a new culture or from another culture
Yeah.
to America, the problem is you don't have the resources. You came as a physician, and you came with some resources, which is really nice, you know. But the problem is if you come and you don't have those resources, and then you're still trying to deal with these problems,
Yep.
and you don't have the support, you
It's
don't
tough.
have the family that you can turn to, you don't have the friends who you can
Oh,
share in your
yeah.
own language what's going on.
Yeah.
No support.
Right, that
support.
it's very hard to have the experience of you're
Yeah.
safe,
Absolutely.
which is that part that you need if you've got some traumatic stress you're trying to recover.
To be able to thrive, we need to
Yeah.
feel safe in our environment.
Absolutely.
Yeah.
Right? And so, to all my wonderful immigrant friends, I am sorry that things are difficult in transition, but I love that you're here, and I love who you are, and it's been an honor and a privilege to meet so many people from so many different countries. And even one of the things that you taught me, your ability to thrive is above some of my lazy ways, Like I look at when you're born in North America, in Canada, the United States, and many parts of Europe, you kind of got a gift going on, and so you're not used to some of the experience some of our immigrant friends have had. And so they come and they are ready to do the hard work. They are ready to work long days, and they have learned to place their trauma in perspective. And so they teach me things, and I'm looking at them and saying, but how can you be so happy? How are you smiling? But so there's lots of things that we can learn from other cultures, and
Absolutely.
Bessel certainly points that out in a few of his videos about the power of things that we learn from some of the old cultures, like the Native Americans, about tribal dance. Dance again comes up,
Dancing,
right?
yep.
And the things that we do in ancient cultures, how the Romans would go out into the fields and rest after battle and decompress. Now we have combat the
Excuse me.
Kmart syndrome, where we
Yeah,
put a young man in Iraq and then we put him on a plane and fly him home and expect him to be normal. You know, it's like we're not broken people, but we have to learn the language about trauma and understand that there's so much that we can do as a culture. And I'm ready to stay on board for this for as long as I possibly can
Yes.
to bring this into the limelight. So we've got some teams. I know I've got people with passion who want to be able to go forward with this.
Absolutely.
We connect these dots.
Changing lives, right? That's
Absolutely.
our mission.
Keep pushing
Yeah.
it forward, because not until people are Stephen Covey's, if we don't change the seat, if we don't move people around the table, not too much is going to happen.
Yeah.
So if we don't bring the doctors and have this conversation with the lay people like us, right? I've got a lot of experience in the field, but I'm still not a doctor. But you know what? I don't have to be. To have love and compassion and consideration for other human beings, create a sacred space to honor people.
Well, you're educating people, right, through your message.
Yep. And right now,
So,
right here,
yeah.
this is the role. So, you know, it's a fascinating piece. So, Bob, if you could go back 20 years and change your field of work, would you change it?
No, I love it. I do. You know, I'm thinking, what is she talking about? I mean, first of all, we'd have to go back 40 years, and you know.
You had a way out, though. 20 years ago, you could have had a way out, and I had to go, just go be
Yeah,
a
I could have had a
professor.
way out, yeah.
And I don't want to have to deal with all of these sad people. I'm scared, because emotions can be scary.
It can be
Right?
difficult, and it
Yeah.
can be, and if you
Yeah.
work in this field, you really have to take care of yourself. And that's why I'm excited to be able to, as we go along, show people some of the techniques that I've learned
Yeah.
that allowed me to stay in this field. Because if you have vicarious traumatization through the stories that people give you, and you don't deal with it, it will stress you out. It will stay with you. It will harm your body.
Yeah.
And so if you do this work, you have to be able to take care of yourself. And there's, you know, I've learned lots of things along the way, and I'm looking forward to being able to share some of that
Yeah.
as we go on.
Yeah. So, and even, absolutely.
Thank
absolutely.
you.
So even on that little tiny note there about like systems, political will, you have to have the will of a country to move forward. This political will of realizing you want to cut health costs and treat trauma,
Oh, yeah.
because it is the leading cause
Oh, yeah.
of disease. And so if we're serious about having a healthier environment, we need to pay attention, and we need to put things in place that allow us to give these tools to people.
Well, we were watching this thing earlier. The World Health Organization
Yeah.
has said that over the next few years, that the bigger cost to the health community is going to be traumatic stress.
Yeah.
Second only to cardiovascular disease.
Wow.
So more people are going to die from things related to complications of
Yeah.
those things than they are of
insane.
cardiovascular disease in
Yeah.
the world. We're talking 1 million people, 1 billion people. A billion. It's very scary when you think about it. But hope's important.
There is.
Oh, there is absolutely.
completely.
Yeah.
Well, I've seen it up front and personal.
Yeah.
Right, and so I love that. So Dr. Bolio, go back 25 years, would you still be doing this work?
Oh, yes, definitely. I
Yeah.
will still be doing this.
Yeah.
Oh, yes. I'm
So-
very happy with what I'm doing.
So when that happens, we know that that's passion,
Yeah.
right? That's
Yeah.
commitment. It's part of who you are. So It's like without it, it's like removing a limb,
Yeah.
so to speak, right? And I think for me, this level of advocacy and standing up for that little girl that's twirling in a dress
Yes,
that's 10 years
yes,
old
yes.
on her bare feet, and we had this conversation. I said,
Yeah.
so my dress was from Salvation Army. I was beautiful.
Yes, you
and
were.
I didn't care, and I want people to have that feeling of feeling in their bodies special, important, and because people are valuable. It's the greatest resource that we have,
yeah.
and we undermine it all the time. And it's not you're more valuable because you have a degree. You're valued because of who you are and what you bring into the world. You don't have to be a certain way. The barefoot child that's running in the sprinkler is just as valuable as the executive over yonder. You know, they're still valuable human beings, and yet we have a tendency to have a pecking order.
Yes.
And so the treatment of trauma can change lives all over the planet, not just in our schools and our communities, but all over the world. That's how big this issue
It's
is.
huge.
So we just got to go with it. It's like, I'm going to keep going no matter what. I have to do it. So with the help of technology, the ability to broadcast live and to be delivered to people all over the world, boy, that's changed things. It's made a big difference. We can put our message out there.
And I'm sure
And
there's going to be a
so-
lot of people that will obtain benefit from it.
Yeah.
So in our next broadcast, we're going to talk a little bit more, or a lot more, about body image, weight loss, the way trauma interferes with loss of weight and diet and perspective. It's so much about food, and that was the other thing, is how much we do around food that influences the way we feel in our bodies. And we're going to talk more about TFT and how, as a simple tool that you can give away, will never get rich at, it's a very tool that we do for ourselves.
Yes.
It's a self-regulating tool. My get out of jail free card.
Right.
That's
You
what
got to
TFT is.
say, TFT stands for.
Thought Field Therapy.
There you go. Thank you.
Because I know TFT, but nobody
Yes,
else
yeah,
out
right,
there
I mean-
knows what TFT is.
Well, you're on a first name basis with it. Yeah,
I'm on
yeah.
a first name basis with it. It's like, I give these cards away to people every day, and when I meet someone that's struggling, I say, here you go, this is it. You can do this in your bathroom, in your bedroom, you can sitting on a plane. It's just like, just start.
Yeah.
No one's going to judge
Yeah.
it. It's not going to hurt to be able to do this, and so bringing it forward. Let's find some other things like the yoga, like the dance. And there's a place for drug therapy that helps with a lot of things that have developed. That's there. And for talk therapy. Absolutely. There's a whole array of different clinical techniques
and I want
that
to be
help.
clear here, because I don't want anybody who's gone and got a pill from a
Absolutely.
doctor to try to deal with their issue
Yep.
to feel bad. Thank God you're trying. Thank God
Keep
you're
going.
paying attention. It's that you're
Yes.
aware that something's wrong.
Yes.
So, right.
Yeah.
So, let's just add a little more to it here. Let's make it work.
Start where you are.
Yeah.
Whoever you are, start where you are by being more informed, by being able to look at different options for you. Take your power back. That's what I would say to myself, to the little girl in me, is take your power back. This is your life. Don't give that away to anyone, even if they're a clinician or a doctor. But work in partnership with them and say, Doc, this is what I want you to understand. This is what I want you to know about me. And all of a sudden, you be your best friend and your advocate. Because I tell you, there's so much power in it allows you to be the person that you want to be and that you have the potential to be. It's out there. It's all around us. We need to be able to be upfront and personal with this stuff. And I'm on your side, and everyone sitting here, Dr. Bolio, definitely on your side. Dr. Bray, absolutely on your side. And San, absolutely on your side. And what was really important is I brought her in green on purpose, because I wanted someone who was going to ask different questions than me, who didn't have the experience and the knowledge about the field of trauma, so would have a fresh look through fresh eyes.
Oh yeah, this is very knowledgeable. Thank you so much for your time and everything.
This is really, so thank you everyone. This has been an amazing opportunity, and I look forward to seeing you on the next show, and we'll be coming back to you live. So take care and watch us on American Eagle Broadcasting. Shirley Ringo, Every Woman CEO. Take care. Bye for now.